Okay, so for our infant assessment, like I said, we want to go least invasive to most invasive. Okay, so we want to leave the baby as undisturbed as we possibly can to start off. So we're going to start with our vital signs and just a general overlook of the baby. So I'm going to unwrap my baby, get my baby down to just its diaper. Okay, and then I'm going to watch this baby breathe for a full minute. Okay. When you watch the baby breathe for that full minute, you're just counting respirations. All right. We're looking to see, do we have any increased work of breathing? Are we noticing any of those retractions that we talked about, which would be the baby kind of sucking the skin or sucking in air around the rib cage? Is baby breathing very quickly? Are we noticing any nasal flaring around the nose? Are we hearing that grunting sound that I talked about, that that noise? Okay. We're just watching baby breathe right now. Okay, after that full minute is done and we've got our respiratory rate, now I'm going to grab my infant stethoscope and we are going to listen for a heart rate. Okay, I'm going to place my stethoscope here between the 4th and 5th intercostal space. All right, and we're going to listen for a full minute. Baby's heart rates are irregular, so it's important that we listen for a full minute. At this point in time, you are also listening for regularity of the heart, listening to hear if you hear any murmurs, any clicks, any gallops, anything like that for a full minute. Okay, this is generally the point where baby is resting well, so let's go ahead and just listen to our lung sounds too. Keeping our stethoscope in the same place, we can listen to breath sounds. Move to the other side, listen to your upper lobe. Now, listening to breath sounds on an infant, the lower lobe, the best place to listen is actually in the axilla. So listen in the armpit on the side, right south of the baby's nipple. That's the best way to hear your baby's breath sounds in an infant. Okay, so we're going to listen on both sides. We want our lungs to be clear and equal. You may hear some crackles, you may hear some wheezes in that initial few hours after birth, but ideally that should not continue, that should not last after those initial few hours. If it does, it requires further evaluation. Okay, because I have my stethoscope on, I'm just right away going to listen to my baby's tummy. Listening to hear if we have any vowel sounds. Like we said before, those usually are present within the first 1 to 2 hours of life. Listening to my vowel sounds. Okay, so at this point, now we've listened to everything. Now our baby doesn't have to be quiet for us anymore, so we can do maybe some more invasive procedures. So one of the things that we could do is take our baby's blood pressure. Okay, like I said, on admission, you will do an initial blood pressure, preferably an upper extremity, and that can be on the lower arm or the upper arm. Okay, check a blood pressure. On discharge, we do blood pressures on all extremities. Okay, and then we're also going to take our baby's temperature with an axillary thermometer. All right, so you do not want to use tympanic on an infant. You always want to use an axillary thermometer like this one. Place it in the baby's armpit and hold it down and wait. Okay, so checking our temperature. We always want to make sure that when we are assessing our baby, we are doing it under a warmer like the one I have here, and that there's heat radiating down and keeping baby warm. Baby does not have the ability to regulate its temperature, so we need to help it with that by using a warming device. Once our vital signs are done, now we want to begin a more thorough assessment of baby. So just like in an adult, you're going to start at the top of the head and you're going to work your way down to the toes. So first thing I'm going to do is just look at my baby's face, okay? Do I see milia? Do I see stork bites? Do I see, are my eyes equal? Are they symmetrical? Are they both opening and closing? Do I have any drainage coming out of my eyes? Looking at my nose, is my nose midline? Am I having any nasal flaring? Do I see any nasal discharge? Or is my nose obstructed in any way? Looking at the lips, I'm making sure that those are symmetrical, that the lips are evenly placed. When I'm looking in the mouth, I'm checking to see if it's pink, if it's moist. What is my baby's sucking reflex like? Do I see any Epstein pearls? Looking at my baby's face, I can see, are my ears properly placed? Are they high or are they low or are they just right? I notice any pits in front of the ears. It's periauricle pits. Okay, so that's just looking at my baby's face. Now what I'm going to do is slightly lift up my baby and I'm going to feel my fontanelles. My fontanelles should be soft and flat. Okay, they should not be protruding. They should not be bulging. They should not be depressed or sunken. Okay, they should be soft and flat. I'm feeling across my suture lines. My suture lines are most likely going to be either approximated or overlapping, though they can be separated. Generally, you're going to see that in a preterm infant, though. Okay, so moving down, we've already looked at our ears. We can kind of look at baby's neck, make sure everything is symmetrical, making sure baby has good movement of their neck. I'm going to lay my baby back down and I'm going to move to checking my clavicles. So pretend baby's laying down. When I'm checking clavicles, I'm running my finger and applying pressure along this clavicular line, checking to feel if I'm feeling any movement of the bone that would be indicative of a break. Okay. Then I'm going to move down and I'm going to feel my brachial pulses on my baby one at a time. Your brachial pulse is found right here on your baby. Okay. Checking for your brachial pulses. Now I'm just going to look at my arms. How do my arms look? Do I have a full range of motion? Do I notice any bruising, any scratches, any lesions, any marks on my baby's arms? Checking both my arms. I'm going to look at my hands. Do they have a palmar grasp? Will the baby grasp my finger when I put it in its hand? Checking my capillary refill. On the hand as well, I want to look at the creases on the baby's hand and check for a simian crease, a crease that goes straight all the way across. That would be a sign of Down syndrome. Okay. Looking for any acrocyanosis, where baby is all pink, but the hands and feet may be blue. That's our hands. So now I'm going to look at the chest, make sure that my nipples are well formed and in the correct place. They're not too high, they're not too low, they're not wide set. Moving down, I'm going to check the baby's abdomen. So we've already listened. Now I'm going to feel, make sure I'm not feeling any bowel loops. Looking at the belly button, making sure that I don't have a hernia, a protrusion there. Okay. I'm going to look at my baby's legs. How are they moving? Are they moving symmetrically? Or does he have full range of motion in his legs? Or is he pulling them up like babies typically do? Once again, looking to see if we have any bruises, any lesions, any scratches. Do we have scattered newborn rash on our legs? What do we see? Looking at our feet, checking my Babinski reflex, okay? Checking my toes, making sure I've got good capillary refill, making sure I have 10 fingers and 10 toes, okay? Then we're gonna move to our diaper area. Do this one as fast as you can, otherwise you're gonna get peed on or pooped on, okay? So on my baby now, I'm gonna check my femoral pulses, okay? Femoral pulses here and here. All right. For a little girl, we are going to just check to see if we have a vag tag. We're going to check to see if we have any drainage. And it's the labia minora, maybe labia majora. What is their orientation to each other? That would give us a sign of maturity. For boys, you're actually going to feel each one of their little testicles and make sure that they have actually descended like they should. You're going to check the rugae. You're going to check the tip of the penis to make sure that we don't have a hypospadias. Okay, we're going to lift up his little bum, make sure that we've got an open anal area, I guess, and that if you have stool present, that's obviously a sign that he has a patent anus. Then what you want to do is actually flip baby over, lay baby on their tummy, okay, and look at their back. Is our back nice? Is our spine nice and straight? Do we notice anything different in our skin? We're going to check here right above their bottom for what's called a pilonidal dimple. So you can see here that there is a skin fold, but you can sometimes see a hole, almost kind of like the pit that we saw by the ear. That's called a pilonidal dimple. We need to make sure that that is closed. If it is not, it's an indicator of spina bifida, okay? So we are checking on that. All right. That typically comprises your newborn assessment. Then we're going to put our diaper back on our baby. You do want to assess your cord as well. You want to assess to make sure that the cord, is it dry? Is Is it soft and moist still? You want to look at the abdomen and look for any signs of infection. If my umbilical cord was still on and you started seeing red rings like you would see on a tree, that would be a sign that there was an infection as a result of the umbilical cord. Okay, that, my friends, is our newborn assessment. Any questions, guys? All right, I'm going to just end our recording really quick.